Welcome to Stimulus Wealth today. Millions of seniors across the United States depend on supplemental security income, known as SSI, to meet their basic daily needs. For many, this monthly payment helps cover essentials such as food, medications, and shelter. However, when unexpected costs rise, especially during colder months, seniors can find themselves facing serious challenges. Heating bills often increase in winter, and for older adults living on a fixed income, even a small jump in expenses can put their financial stability at risk. To address this growing concern, new emergency relief programs are being introduced to provide extra heating and housing support, specifically for seniors who rely on SSI. The focus of these efforts is to ensure that no senior has to choose between keeping their home warm and paying for groceries or medicine. Many seniors live in older homes that are less energy efficient, which means heating systems must work harder and cost more. Others may rent apartments where utility costs are unpredictable and harder to manage. Rising energy prices only add to the burden. The emergency relief measures are designed to step in and help cover these higher heating costs, giving seniors some financial breathing room during the most difficult months of the year. Housing insecurity is another major issue faced by many SSI recipients. With rents increasing in many parts of the country, seniors are finding it harder to secure safe and affordable housing. The emergency support programs aim to help seniors stay in their homes by offering temporary assistance with rent and utility bills. For those at risk of eviction, emergency housing aid can be a lifeline that prevents homelessness and ensures that seniors continue to live in stable, secure environments. This kind of targeted relief not only helps individuals, but also reduces strain on local shelters and community services. Eligibility for these programs typically depends on income and household situation, with seniors on SSI being among the primary groups prioritized. Applications for assistance may vary from state to state, but many programs are streamlining the process to make it easier for older adults to apply. In some areas, relief funds are distributed automatically to those who qualify, while in others, seniors may need to complete a simple form or provide documentation of their expenses. Community organizations, local housing authorities, and social service agencies are often key partners in making sure seniors know about. One important part of this relief effort is the focus on heating. Energy assistance programs can cover part of a senior's monthly heating bill, provide emergency grants when bills are overdue, or even help with repairs or upgrades to inefficient heating systems. For example, some programs may pay for weatherization services, such as better insulation or sealing of windows and doors, to lower overall energy costs in the long term. These measures not only provide immediate relief, but also reduce future financial strain for seniors living on SSI. Housing support goes hand in hand with heating assistance. Seniors facing eviction notices or struggling with late rent payments can access emergency housing funds. In some cases, these funds are paid directly to landlords or utility companies to prevent service shutoffs or evictions. For those already without stable housing, temporary shelter assistance and transitional housing programs are available. These efforts are especially important for seniors, as homelessness can have severe impacts on both physical and mental health, particularly for individuals already managing medical conditions. The need for extra heating and housing support has become more urgent due to rising costs across the board. Inflation affects everything from groceries to gas, but energy prices and rent increases hit seniors especially hard. Unlike younger workers, who may increase their income through extra work, seniors living on SSI have limited ways to adjust their budget. This makes targeted relief programs essential in bridging the gap between fixed incomes and rising expenses. Families of seniors also benefit when these support measures are in place. Adult children or relatives often step in to help when older family members cannot afford housing or utilities. While many families willingly support their loved ones, the added financial pressure can create stress. Emergency relief programs reduce this burden by ensuring that seniors receive direct support, allowing families to focus more on care and emotional support rather than financial strain. Community impact is another important consideration. When seniors remain stably housed and their utilities are secure, neighborhoods benefit as well. Stable housing reduces turnover, strengthens communities, and helps maintain local economies. Seniors often contribute to their communities through volunteer work, mentorship, and caregiving for grandchildren. By ensuring their basic needs are met, society as a whole benefits from their continued involvement and presence. Awareness is key to making sure these programs reach the people who need them most. Local governments, non-profit organizations, and social workers are playing a critical role in spreading information about the availability of emergency relief. Flyers, community meetings, and outreach through senior centers are common methods of communication. Additionally, many states now offer online applications or hotlines to guide seniors through the process of applying for assistance. Simplifying the process is especially important for older adults who may find paperwork or digital applications challenging. Healthcare providers and pharmacists are also being encouraged to inform seniors about available assistance, since they are often trusted sources of information. Seniors visiting clinics for checkups or prescriptions may not be aware of housing or energy support programs, but a reminder from a doctor or nurse can make a difference. By connecting these support systems, more seniors can be reached before they face serious crises. Emergency relief also plays an important role in public health. Cold homes are not just uncomfortable, they can be dangerous. Prolonged exposure to low indoor temperatures increases the risk of illnesses such as pneumonia, heart problems, and flu complications. By ensuring that seniors can afford adequate heating, these programs help protect vulnerable individuals from preventable health risks. Housing stability is equally critical, as homelessness or unstable living situations can exacerbate chronic conditions and limit access to regular medical care. The funding for these emergency relief efforts often comes from a combination of federal, state, and local sources. Some programs are supported by federal energy assistance grants, while others rely on state-level emergency funds or partnerships with non-profit organizations. Local utilities may also participate by offering reduced rates or forgiveness programs for overdue bills. This collaboration across different sectors highlights the importance of a shared responsibility in protecting seniors during times of financial difficulty. Looking ahead, many advocates believe that more permanent solutions are needed to address the recurring challenges seniors face with heating and housing. While emergency relief programs provide critical short-term support, long-term policies that expand affordable housing options and stabilize utility costs are equally important. Expanding energy efficiency upgrades, increasing funding for housing vouchers, and improving access to SSI itself are some of the measures that could help ensure greater stability for seniors in the future. Disclaimer: this content is for informational and educational purposes only. It does not constitute financial, legal, or government advice. Program details, eligibility requirements, and availability of emergency relief assistance may vary by state and are subject to change. Seniors or caregivers seeking support should verify the latest information directly with official government websites, local housing authorities, or recognized social service organizations. We do not guarantee approval for any benefits, and viewers are encouraged to consult qualified professionals or official resources for personalized guidance.